Dr. Sonya Gordon is a veterinary cardiologist at Texas A&M. Heart disease in dogs. It astounded me when you rattled off the statistic that, what was it, 60%, 60% of dogs under a certain weight, over a certain age, are likely to have heart disease.
Very true. It's epidemic in its proportion when you consider it like that.
Why? I mean, had this always been, or is it because it's a disease of older dogs? Our dogs are living longer than ever before.
I do think that that's probably true. I do think dogs live a lot longer thanks to really good veterinary care and really good owners. But it is a disease that's been out there for a long time. It exists in people as well. It's just a disease associated with getting older.
That's pretty depressing, I guess. But it's called mitral valve disease in dogs. What are some signs?
Early in the disease, there may be no signs at all except to your veterinarian when he listens with a stethoscope and hears a murmur, a heart murmur, an abnormal heart sound. But as the disease progresses, you may be able to see clues that your dog is having trouble dealing with this disease, and that may be related to trouble breathing, difficulty breathing, shortness of breath, not catching their breath as fast when they have exertion, and they may become intolerant of their regular exercise regime. So they may have some tiredness earlier in their exercising.
Now, that's in dogs. In cats, different kind of heart disease, and it's not necessarily a disease of older cats.
So it's different because although your veterinarian will listen to your heart for evidence of a murmur, many cats with heart disease may not have a murmur or any clue that even your veterinarian can detect with just a physical examination or a stethoscope. So it's sneaky. It's a little bit silent. But the clues that your cat could have heart disease are also somewhat ambiguous. They may be consistent with other diseases too, but you might notice changes in behavior. Your cat might not interact with the family normally or hide, become reclusive, changes in appetite, especially reductions in appetite and reductions in weight. But more specifically, you may see trouble with breathing. They won't cough like dogs normally do, but they may have evidence of labored or lots of effort associated with their breathing, particularly after some exertion. And they may also develop signs of lameness or paralysis even in their back legs particularly, or even just pain when you go to pick them up.
Now, if there are signs that your veterinarian thinks, oh, well, this might be heart disease, or your veterinarian is listening with the stethoscope and suspects something, then what are some screening tests that you can now do?
This is the part that's a little confusing to pet owners because depending on what disease your veterinarian is worried about will depend on what test they offer you. So if it's a dog that they're suspicious has this mitral valve disease, they'll tell you the best test and the recommended test by cardiologists is to do a set of x-rays of the chest as a starting point. They may also then recommend things like blood pressure and an echocardiogram or ultrasound of the heart for additional information.
And there's a blood test now.
And maybe even a blood test called NT-proBNP to, again, help discern the severity of the disease and help determine if a medication should be introduced or changes in the dog's behavior, lifestyle should be introduced.
And for cats, it's just a little different.
It's a little different. X-rays are not very good for screening for cats, and so they may automatically recommend an ultrasound of the heart, or they may recommend the blood test, the NT-proBNP test, because that's a very good way to stratify the potential risk that your cat has heart disease. The blood test won't definitively diagnose it, but it will help you and your veterinarian understand the potential risk that your cat has for having a very important, potentially life-threatening disease, and then help determine which cats should then go on and have an ultrasound exam.
Through these screening tests, including the really simple blood test, today, can we stretch out the amount of time? There's no instant cure for heart disease, I know. But can we stretch out the amount of time where the dog or cat is going to have quality of life before the heart disease becomes more significant?
So the first goal of therapy, if your cat or your dog is apparently healthy and having no problems, is to introduce a therapy that would change when or delay the time that they would ever develop signs, and hopefully delay them indefinitely or at least long enough for them to die of toenail cancer or something like that. But ultimately, we don't have proof that those things happen, but we have very good reason to believe that it does, and so we often do add medications with that thought. But when your dog or cat becomes sick, has clinical signs and problems associated with their heart disease, we have very good medications that can remove those clinical signs. And you won't even realize that your pet is sick if we use them appropriately, and you can deliver them to the patient on a daily basis and then keep them living longer as well.
And if we don't realize the pet is sick, well, then presumably the pet isn't feeling sick and the quality of life is improved, which is what it's all about.
It's all about quality of life.
Yeah. Dr. Sonya Gordon, thank you very much. Now, for further information, great website, yourpetsheart.com.